Design thinking is a popular vernacular for systems thinking. It's about using creative problem-solving techniques to innovate. It's hard to innovate if you're only analyzing data. You need to think differently. When you can do that, and then you look at that information as opportunities, you can innovate and create new solutions to problems. Well, I'd say it's often underestimated. It's way easier for companies and institutions to think about their needs than the user's needs. So a big part of the role we play is to refocus organizations on what their users care about. Sensors are, in your phone. Sensors are being worn on your wrist. Sensors are being turned into Band-Aids that are a single-use, one-day, heart monitors. Sensors are being, they're all over our built environment, inside homes, inside hospitals, inside cities. So this data is being collected everywhere, and you've heard the term, big data, and what do we do with it? We got so much data, we don't know how to manage it, but the difference today is that these sensors are available and they're being built into things. Now, the design issue is, how do you turn this data into valuable information, and how do you get that valuable information to be interpreted in a way that the end user actually can weave that into their lives? Step one is to make it attractive to me so I use it more than a week. Step two is to engage me in a community of people that can influence my use of that device and my sharing of information, so that I'm motivated to interact with others, because it's communities of people that can keep you on track. But step three, the step that nobody's really working on yet, is bridging the patient-doctor relationship. Designing a system that works for the patient, but can also inform a doctor in a way that he or she wants to be informed. So filtering crazy amounts of information and data and patient-recorded histories, and then making that available in a way that the doctor can use it to be a part of the care, providing care. And it's not just the end user, it's other stakeholders. So how do we actually design the relationship between that user and their community, or that user and their physician, or that user and some advisor, and make this platform that we're creating, multi-user friendly. We have been doing work with a company called IDEO Health in Boston. They are a company that's actually looking biggest picture at the nation's population, and trying to engage the whole population in small behavior changes that will affect their health over time. So making them conscious every day of an activity that they can do that will make them healthier. Basically raise the level of understanding about all the aspects in your life that affect your health. If I want to be healthy for someone else, I need to be able to throw the baseball with my grandson. I want to see my granddaughter's graduation. Those are the motivators for behavior change and healthy activities. Once you get sort of past the "it's only about me" generations. So the way you provide information to those stakeholders, or those cohorts, is different than the way you provide information to the 25-year-old or the teenager who is trying to address some kind of chronic disease, obesity or whatever. The thing that I would recommend you do is take a good hard look at the very specific community you want to serve. Don't try to provide a one solution fits all to the world. Find a real problem and solve it better than anybody else can, using whatever array of sensors you think is required to collect the data you need, interpreted correctly so that you can help that individual, with this issue. If you really want to make an impact, and if you don't want to just be the app flavor of the month, engage doctors and clinicians in the process of quantifying the value you bring to the equation.
How is technology changing your world? Join the conversation at tdo.org/pull.